In this video, we will discuss tropical diseases that are commonly found in tropical regions. Understanding these diseases is crucial for medical professionals, as they present unique challenges in diagnosis and treatment. We will also explore the importance of considering travel history in identifying potential exposures and determining appropriate diagnostic approaches. This topic requires a level of complexity and terminology suitable for medical students, with enough details to ensure a comprehensive understanding while still keeping the information manageable. Slides with images and graphs depicting malaria prevalence worldwide appear on the screen. Professor, malaria, a mosquito-borne infectious disease, affects millions of people worldwide. The epidemiology of this disease varies, with transmission rates influenced by factors such as geography, climate, and socioeconomic conditions. The diagnosis of malaria involves studying clinical symptoms, microscopic examination of blood smears, and, in some cases, molecular testing. Management strategies encompass anti-malarial medications, vector control measures, and education on disease prevention for at-risk populations. Professor, dengue fever, caused by the dengue virus transmitted by mosquitoes, presents with flu-like symptoms, severe pain, bleeding, and life-threatening complications. Early detection, supportive care, and mosquito control are essential for effective management and prevention of outbreaks. Visuals illustrating the clinical manifestations and geographic spread of chikungunya are shown. Professor, chikungunya is an emerging viral infection characterized by severe joint pain, high fever, and rash. Its clinical presentation often mimics dengue fever, making accurate diagnosis challenging. Understanding the outbreak patterns and geographic distribution of chikungunya is essential for public health preparedness and response. Symptomatic relief and supportive care are currently the mainstay of management for chikungunya. In this section, we will discuss the Zika virus, its transmission through Aedes mosquitoes, and the resulting congenital defects in babies of infected mothers. We will also explore prevention strategies, including mosquito control and public health campaigns targeted at pregnant women and their partners. Visuals showcasing the different forms of leishmaniasis and medications used for treatment are shown. Professor, leishmaniasis, caused by protozoan parasites transmitted by sandflies, manifests in cutaneous, mucocutaneous, and visceral forms. The clinical presentation and severity depend on the species of leishmania involved. Treatment options vary, including medications such as antimonials, amphotericin B, and miltefosine. Prevention measures primarily focus on vector control and avoiding sandfly bites in endemic areas. In tropical areas, yellow fever is a serious public health issue, transmitted by infected mosquitoes. Knowing the transmission cycles involving different mosquito species is crucial for controlling the disease. Yellow fever can lead to mild flu-like symptoms or severe hepatitis with hemorrhagic complications. Vaccination is the best way to prevent it, and travelers to endemic areas need a valid yellow fever vaccination certificate. Images depicting Japanese encephalitis transmission areas and graphs illustrating vaccination coverage rates are shown. Professor, Japanese encephalitis, a mosquito-borne viral infection prevalent in certain parts of Asia, mainly affects the central nervous system. Understanding the epidemiology, including the role of pigs and mosquitoes in disease transmission, is crucial for planning vaccination campaigns. Vaccination is recommended for individuals traveling to endemic regions or residing in high-risk areas during the transmission season. Slides displaying the global distribution of rabies and images illustrating proper wound cleaning and post-exposure prophylaxis procedures are presented. Professor, rabies, a viral zoonotic disease primarily transmitted through bites from infected animals, presents a global public health challenge. Prevention includes vaccination of domestic animals, control of the disease in wildlife populations, and education on safe behaviors to avoid animal bites. In case of exposure, post-exposure prophylaxis combining wound cleaning, rabies immunoglobulin administration, and multiple doses of the rabies vaccine is necessary. Extraction from the prior text. African trypanosomiasis, or sleeping sickness, is caused by parasites transmitted by tsetse flies. It has 2 stages and is challenging to diagnose. Treatment depends on the type of parasite. Controlling the tsetse fly and improving healthcare are crucial in managing this disease. Images of Salmonella bacteria and graphs depicting antimicrobial resistance trends are shown. Professor, typhoid fever, caused by Salmonella typhi, remains a significant global health problem, particularly in areas with inadequate sanitation and hygiene. The emergence of antibiotic-resistant strains poses additional challenges in treatment. Vaccination plays a crucial role in disease prevention. Enhanced surveillance, improved sanitation, and hygiene practices, along with prudent antibiotic use, contribute to effective management strategies. Slides illustrating schistosoma life cycle and photos depicting clinical symptoms are presented. Professor, schistosomiasis, a parasitic disease caused by trematode worms, affects millions of people worldwide, primarily in tropical and subtropical regions. The clinical stages include acute, subacute, and chronic phases, with varying symptoms and involvement of different organ systems. Diagnosis relies on detecting parasite eggs in stool or urine samples. Prevention measures include access to clean water, sanitation, snail control, and mass drug administration in high prevalence areas. Image slides showcasing the life cycles of hookworms, whipworms, and Ascaris lumbricoides are presented. Professor, helminthic infections caused by hookworms, whipworms, and Ascaris lumbricoides remain prevalent in many parts of the world, particularly in areas with poor sanitation and hygiene practices. Understanding the morphology, life cycles, and transmission modes of these parasites is essential for accurate diagnosis and effective treatment. Management options include anthelmintic medications and health education regarding sanitation, personal hygiene, and proper waste management. In the conclusion of this video on travel history and tropical diseases, we have discussed the diagnosis and management of malaria and dengue fever.